give you details about the format and structure of reading Part A and the part it plays in achieving a pass score in reading. We will show you a quick guide on how to summarize the text, how to read visual text, and finally, how to understand the 3 question types and how to answer the 20 questions within. So how important is Part A in reading? The reading subtest carries a total of 42 points. Remember that you will need to aim for 30 points to get the passing score of grade B in reading. 20 points can be achieved with Part A. Part A is also the easiest out of the 3 parts of reading. It's easy and it possibly has 20 out of the 30 questions that you need. If you manage Part A well, aiming for 18 to 20 points, Part A can account for more than 50% of your passing score. Part A has 4 texts for you to read. It consists of 3 question types: matching, short answer, and sentence completion, or sometimes called gap fill. There will be 20 questions in total for you to answer within 15 minutes. This is one of the challenges in Part A. 4 texts to read, 20 questions to answer within this short span of time. So you really need to be quick. This is the skill that you will be tested on in Part A. You must read fast and find your answers very quickly. To do this, we will teach you skimming and scanning skills to improve your speed reading skills for the test and ace Part A. Before you begin, know the instructions. Remember, you have 4 texts to read, text A, B, C, and D. You will need to answer 20 questions based on this text, and you will answer them within the question paper itself and no need to transfer. You will be given 15 minutes as part of your time limit for this test, and remember that in reading, wrong spelling is wrong. In this lesson, we will give you details about the format and structure of reading Part A and the part it plays in achieving a pass score in reading. We will show you a quick guide on how to summarize the text, how to read visual text, and finally, how to understand the 3 question types and how to answer the 20 questions within. As you only have 15 minutes to complete the test, it is important that you don't spend too long reading the 4 texts. Read only what is necessary and understand the information hidden in each text. To do this, you must learn to summarize. In text A, we note that there is no heading, but we do have 3 words written in bold. This signifies that they are important. If you read the sentence next to these bold words, you will notice that the sentence is giving you the meaning and definition of all 3. So we can remember that in text A, it tells us the meaning and definition of what a fracture is, what a dislocation is, and what is a sprain. In text B, we have a heading, simple fracture of limbs. The text also includes 3 subheadings, immediate management, clinical assessment, and another management. This tells us that the text B is all about how to assess and manage or treat fractured limbs. For text C, we find a slightly different text. This is called a visual text, which is in table form. In a table, check for the headings or the titles, then find your column and your row headings. You will notice that in this example, there is only one row. This signifies that only one subject is being discussed. It is all about morphine. Morphine is a drug, so think of other synonyms or paraphrase for morphine. This can be medication, medicine, maybe painkiller, pain reliever, prescription, or treatment. For text D, we find a numbers text with a heading. The heading states that this is a technique for applying plaster backslab. Technique means a method, a process, or a procedure, a way of working, which means that even though we didn't read numbers 1 to 1 to 8, we know that they are the steps to be taken for applying plaster backslab, which is a form of a treatment for a fracture. Part A assesses your ability to locate specific information from these four texts, text A, B, C, and D, in a very quick and efficient manner. The four texts relate to one single healthcare topic only. In this example, it is about fracture. Each text discusses a specific knowledge about fracture. Text A gives meaning and definition. Text B is all about assessment and management of fractures. Text C is how to treat fractures with morphine. And finally, in D, it's all about applying a plaster backslab to a fractured limb. Your job is to identify what the purpose and functions are of each text, and how are they similar or different from each other. Only A gives meaning, but B, C, and D all have treatment information. B is about different treatment, C is a drug treatment, while D is a treatment procedure. This knowledge will help you choose the correct text later on once you are answering your questions. Remember that one or two texts will contain a numerical or visual text. This could be a table, a flowchart, or a graph. Candidates won't be asked to make any calculations, but to just simply find the answers based on that visual text. In this lesson, we will give you details about the format and structure of reading Part A and the part it plays in achieving a pass score in reading. We will show you a quick guide on how to summarize the text, how to read visual text, and finally, how to understand the 3 question types and how to answer the 20 questions within. So how do we find answers in a visual text? Is it difficult? It can be difficult or confusing only when you don't know what to do. As part of our course, we teach you different strategies to read and understand visual text much better. For this example, we are looking at a table. Again, check for the heading, the column heading, and the row headings. The number of information tells you the number of topics being discussed. Ensure that you are familiar with them. Our heading states drug therapy protocol. This means this is a table about a medication or a treatment or a process showing the procedure of using morphine. It then gives you information about the form, the strength, the administration, the dosage, and the duration of morphine. But it is also equally important to note that apart from the column and the row headings, we can also find the paragraph at the top and at the footnotes in the bottom. The top part tells us who administers morphine, while the bottom part tells us what you should do when the patient is of a certain age or showing different side effects. In this example, we are being asked how much morphine is to be given to an 85-year-old patient. This means that our answer will hide in the recommended dosage column. 85 years old is a clue. You will find this in the footnote area. Use the lower end of your dose range in patients over 70 years old. Well, 85 is over 70, which means in the dosage, we will use the lower end of the dose range, which is 0.1 to 0.2 milligrams per kilogram, or there's a second dosage which says initial 2 milligrams, then 0.5 to 1 milligram. But on the second dosage, or the lower dose, it doesn't have the word kilogram as discussed in your question. Hence, we will consider the first range of 0.1 to 0.2 and choose the lower end. Our answer is therefore 0.1 milligram per kilogram, but as kilogram is already in the question, it is now optional. So our answer will only be milligrams. And that means that 0.1 being the lower end of the dose will be our final answer. 0.1 milligrams because the word kilogram is already in your question. The other common visual text is a flow chart. Why is this common or important in healthcare? Flowcharts help clarify complex processes. It identifies steps to follow for procedures. It is a tool used by healthcare professionals to define and improve communication process and helps in decision making. In this flowchart, we find one heading and two subheadings. The arrow tells you what to do and where to go. So for open head injury, there is only one suggestion. Consult the MO immediately. For a closed head injury, there are different processes to follow. The first one is to check if your patient is showing intermediate or high risk factors. If your answer is no, we go to the boxes for the no. If the answer is yes, we follow the flow to the right. Let's give this question. We need to find the tests required if a patient has high-risk factors. There is no high-risk factor in open head, so we go into closed head. We stop at the risk factor question, and then we're going to go to yes. In there, we will find CT scan as being our test. So in here, the answer is CT scan. Another type of visual text is a graph. Candidates won't be asked to make any calculations, but to simply find the answer based on the clues given in the question. For graphs, look for your heading, the X and the Y axis, and any other subheadings or topics within your text. In this graph, we also have two paragraphs on the side. By simply following the clues in your questions, you should be able to find your answer. For example, this question wants you to find the plasma paracetamol concentration level. We find them on the left and the right side. Make a decision as to which one you would go for. I have decided to do the milligram per liter on the left, so my answer should have milligram per liter written on it. Next, I will use the clues 10 hours and stop on high risk. From there, I will move to the left to find my plasma paracetamol concentration level, which is 35. So my full answer is 35 milligrams per liter. For this next question, it wants us to find the name of the medication. There are no medications inside the graph, so we know that our answers are hiding on the two paragraphs. So using the clues 5 hours and 170 milligram per liter, we now know that we need to look at the normal temperature line paragraph. This then tells us that the correct answer is acetylcysteine. In this lesson, we will give you details about the format and structure of reading Part A and the part it plays in achieving a pass score in reading. We will show you a quick guide on how to summarize the text, how to read visual text, and finally, how to understand the 3 question types and how to answer the 20 questions within. Once you have managed the skill of summarizing the text and understanding how to read visual text, it is now time to move on to answering the 20 questions, which are split into 3 question types. The first question type is matching. There can be 5 to maybe 7 questions in this part. This is always the first part of the test. In matching, you have to answer in which text you can find the information in your question. So you simply answer, is it in text A, text B, C, or D? To do this, remember the summaries about the text and use the keywords in your question to match them. Question is looking for a procedure for delivering pain. Pain relief is morphine. So we can confidently answer letter C in question number 1. For question number 2, it's about a procedure for splinting. Using your medical knowledge, you should know that plaster backslab is a type of a splinting procedure. Hence, the answer in here is text D. You do the same strategy for answering questions number 3 to 7. Majority of our students can answer 7 questions within 1 minute, leaving them plenty of time to answer the remaining 13 questions in Part A. After matching, your questions can either be short answer or sentence completion questions. In short answer, we also use keywords to identify which text we should go for. For questions 8, we can probably find our answer in letter B or in text D, as these are the texts that you possibly will elevate a patient's leg. For question number 9, this is slightly better as the word morphine is already given. Hence, we need to go to text C to find our answer. We do the same for the remaining questions. For sentence completion, the strategy is the same as what we've done for short answer. But you have to be careful as sentence completion requires that your answer is also grammatically correct. So look for clues before and after your gap fill line. In this example, we have the article a in both questions 15 and 16. This signifies that our answers should be singular. So remember, in order to ace part A of reading, remember to summarize the text first. It is important that you know what each text topic is all about. Understand their similarities and differences. Choose your keywords, minimum of 2. They will help you match them to a text and guide you as to where the answers are. Your answers also need to be correctly spelled, and in sentence completion, it also needs to be grammatically correct.